How can I prepare for urodynamic testing to feel less awkward? If the idea of urodynamic testing makes you feel a bit uneasy, you're not alone. Many people feel nervous about personal procedures like this, but understanding what to expect can really help ease those feelings. Urodynamic testing is a safe and common way for doctors to see how your bladder and urinary muscles work together. It's especially helpful if you're dealing with bladder issues or being checked for bladder cancer. First, knowing what happens during the test can make it less intimidating. Usually, a thin tube called a catheter is gently inserted into your bladder through your urethra. Sometimes, another catheter is placed in your rectum or vagina to measure abdominal pressure. The bladder is then filled slowly with water, and you might be asked to tell the doctor when you first feel the urge to urinate or when the sensation becomes strong. You may also be asked to cough or strain to see how your bladder responds. The whole process takes about an hour to an hour and a half, and most people find it only mildly uncomfortable rather than painful. On the day of your test, stick to your usual routine. There's no need to fast or change your diet, but it's best to avoid caffeine because it can irritate your bladder. Drink enough water so you arrive with a full bladder, unless you normally use a catheter. Then follow your usual routine. If you take medications that affect bladder function, like certain bladder relaxants, your doctor might ask you to stop them a few days before the test. Continue other medications unless your healthcare provider advises otherwise. If you have constipation, your doctor might suggest using an enema beforehand to get the most accurate results. Also, tell your doctor if you're menstruating, have diarrhea, or symptoms of a urinary tract infection, as the test might need to be rescheduled. Arriving a little early is a good idea. It gives you time to fill out paperwork and ask any questions. The staff will explain each step and will be there to support you. Remember, no sedation is used, so you will be fully awake during the procedure. The insertion of the catheters might cause brief discomfort, but this feeling usually passes quickly. Sometimes numbing gel is used to help with any discomfort, and most people find the procedure tolerable. If you're feeling anxious, let the staff know. They can talk you through what's happening and use distraction techniques to help you relax. After the test, the catheters are gently removed, and you can empty your bladder. You might feel a little burning when you urinate afterward, but this is temporary. Drinking plenty of water can help soothe any irritation. If you experience severe pain, fever, or other unusual symptoms, contact your healthcare provider promptly. Understanding how your bladder functions is especially important if you're concerned about bladder health or bladder cancer. The information gained from urodynamic testing helps your doctor decide the best treatment plan and monitor your condition over time. While it might feel awkward at first, remember that this is a routine, safe procedure performed by trained professionals. The key to feeling less awkward is preparation and open communication. Follow your doctor's instructions carefully, and don't hesitate to ask questions or share your concerns. The staff is there to support you, and knowing what to expect can make the experience much more manageable. Keep in mind that your comfort and understanding are priorities, and the information from this test can be very valuable for your health.